Here in Niagara, we're at about the provincial average rate for breast cancer screening at about 63%. October right now is breast screening month, which is a good time to try to get that number a bit higher. We're joined by Dr. Abhirami Hallock of Niagara Health. Doctor, 63%, yes, we're at the provincial average, but this is still quite low.
So I agree. I think that, Ontario women have done extremely well in terms of scheduling their mammograms as recommended by the Ontario Health Screening Program. But I think this year especially it becomes important to speak to women and remind women to, if they're overdue for their screening mammogram, to schedule for this, as we know that over the COVID years, that number has further decreased. Screening mammograms are known to save lives, as we are able to detect breast cancers much earlier, where the treatments work better, decrease the chance of recurrence, and as a result, improve survival rates.
Doctor, during the pandemic, many women may have not been able to get a breast screening done. So it's important now that things are getting a little bit more back to normal, that we get back into the rhythm of doing this every couple of years.
Absolutely, Mike. So I would say that women between the ages of 50 to 74, if you're considered as an average risk, so we know that the biggest risk for breast cancer is age. As we age and get older, our risk of breast cancer goes up. It peaks between the ages of 70 to 74. And the Ontario Breast Screening Program allows women to self-refer between this age range. It is important to remember that there is really no upper limit to screening, and therefore women who are older than 74 can speak with their family doctors or their community health providers and decide whether it's something that they would be recommended for them based on their general health.
Doctor, I need to understand the Ontario Breast Screening Program, the OBSP, a little more clearly. It works for those 50 to 74 years of age. Outside of that age range, what does this mean? Do they have to pay for breast screening?
Screening is always covered by OHIP, but within the Ontario screening program, between the ages of 50 to 74, women can self-refer. So there are 3 sites in the Niagara Health at St. Catharines, Welland, Niagara Falls. There is mobile centers in Port Erie and Port Colborne, and women can self-refer, and they will have letters where there's automatic recall, as the screening guidelines is within this age group for women to get their mammograms every 2 years. For women who are younger than 50 years old, if they think that they would like to discuss with their family doctors appropriateness for screening, they can make an appointment and can be referred by their family doctor, and similarly for patients over the age of 74.
Doctor, how often would you recommend anybody outside of the range of 50 to 74 years of age does a self-examination?
Many years ago, self-exam was highly recommended. Now, I think it is important for women to do a self-exam. This is not something that you need to do on a daily basis. I think it's more important for women to ensure that they've actually had their screening mammograms, as the mammograms are able to pick up cancers that are not palpable on clinical exam.
You have, I think you mentioned some mobile clinics as well. Where are these mobile clinics and how often are they operating?
So the mobile clinics are in Fort Erie and Port Colborne, and the information is available on the Niagara website, and patients can either self-refer or be referred through their family doctors.
If a woman is diagnosed with breast cancer, the Walker Family Cancer Center becomes a part of their life often. In many cases, what goes on at the cancer center?
That's a great question. When a woman is diagnosed with breast cancer, this can be, it changes a woman's life. It can be quite anxiety, distressing, and patients can feel very overwhelmed. Patients, when they are referred to the Walker Family Cancer Center, will be met with a caring and compassionate team that understand that it's important for women to make connections and relationship with their healthcare providers. Within the Walker Family Cancer Center, we work as a team because there are many aspects within a patient's journey in decision-making and treatment of breast cancers. And this includes nursing staff, specialists such as oncologists, social workers, dietitians, and we are there every step of the way. If they have been diagnosed with breast cancer, and usually it's important for women to remember that when you have an abnormal mammogram, many times it can be, you may require further testing, but not all of these abnormalities turn out to be cancers. And if you are diagnosed with a cancer, it'll also be important for your first visit to come with someone, a family member, a loved one, and remember and it's also important for them to remember we don't expect them to remember everything, that we understand that it can be quite overwhelming, and therefore the team will be there to provide information multiple time points during their journey.
Does the treatment for someone who does test positive for cancer, does it usually involve a combination of radiation and chemotherapy?
Yeah, so the primary treatment for breast cancer is surgery. And chemotherapy and radiation are additional treatments that are recommended to ensure that the chance of the cancer coming back is brought down to as low as possible. In some cases, the chemotherapy, based on the findings in the biopsy, would be recommended prior to this surgery.
How do we get these screening rates up here in Niagara? I know today is an attempt to remind women. What else do we do here at Niagara Health? Are there other efforts?
So if I can speak directly to your audience and say that if you are a woman listening to the show or know someone who may be in the age group, please ask them if they're overdue, or remind them to make an appointment to have their screening mammogram, as it's the single most thing that they can do to minimize their chance of finding a cancer that may be difficult to treat.
Dr. Hallock, thank you so much for joining us today.
Thank you for your time.